Everybody gather near. The doctor's in the house, so lend him your ear. The things he can say might even make your day. He might even help your pain go away. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. Doctor is in the house. Let the doctor know what's bothering you. The doctor is in the house. If you have a pain, call a doctor. If you have a sprain, call a doctor. Let the doctor know what you're going through. Let him tell you what's good for you. Because the doctor is in the house. The doctor is in the house. Call a doctor. Call a doctor. Call a doctor. Call a doctor. Tell me what's happening now.
Hey, ladies and gentlemen, Dr. Ron here. Dr. Ron, host of Dr. Ron Unfiltered, Uncensored. Welcome to a great show today with a special guest, Professor Brian Peskin. Ladies and gentlemen, just thank you for listening to the show and spreading the show around. You know, if you don't catch us live, we are on Alexa, Apple Podcasts, Spotify, Google Play, even that Waze GPS app where you can listen to us on there. So we're just about every place. In case you missed the show, you can get us 24/7. And I want to wish everybody and greet you with an attitude of gratitude, because when you become more aware and appreciative of the good things that either you or other people do, it's usually easier to accept the unfavorable things too. Expressing gratitude for your own strengths and accomplishments, relationships and mentors and good intentions makes it easier to cope with harder times and weaknesses. The same can be said for appreciating others. And as I said last week, when somebody does something good for you, go ahead and thank them and really mean it. Ladies and gentlemen, this program contains general medical information. The medical information heard on this program is not advice and should not be treated as such. You are encouraged to confirm any information obtained from this program with other sources and review all information regarding any medical condition or treatment with your physician. I'd like to start out the show by wishing the Limbaugh family, sending them our prayers and best intentions as he battles cancer. He sure is a giant in the radio industry, and we just, God bless him. Also, just before we get to Professor Peskin, I want to just talk a little bit about the coronavirus. I'm going to have a whole program on this next week. Is it a hoax or not? They say this virus is new, but how come 4 months before they talked about it, Novartis had applied for a vaccine for this virus? So, as they're saying in the UK, the current global panic in reaction to the emergence of a fairly mild new virus is wholly unjustified and amounts to mass hysteria. Governments around the world should be containing the hysteria, not encouraging it. It is also essential to reestablish normal life as soon as possible and get people back to work. There is no evidence that this virus poses any greater threat to those who catch it than many other forms of the flu virus. Ladies and gentlemen, if we really want an epidemic, you'll have to look no further than the medical profession. Guess what? 225,000 Americans die each year from iatrogenic causes, meaning their death is caused by a physician's activity, manner, or therapy. When you include deaths related to diagnostic errors, errors of omission, and failure to follow guidelines, the number of hospital deaths skyrockets to 440,000 per year. Doctors are the third leading cause of death. That is an epidemic, and one that we are not fighting. One that we're not fighting at all. Let me just take a minute here. Is this you, Dr. Peskin?
Yeah, Professor.
Professor?
Mm-hmm.
Okay, okay, thank you. I just want to make sure Professor was on the line. So we have today, and I'm not going to go on with the coronavirus because we'll have a whole program to discuss this next week. And he has so much information, and I have learned so much from him. Even his presentation today can even be applied to viral infections, where you have this biofilm. And we'll talk next week about the cell membrane and the biofilm and how colloidal silver and essential fatty acids may play a role in keeping you healthy. But Professor Peskin is a world-leading scientist specializing in essential fatty acids. He coined the term PEOs, which means parent essential oils, and their direct relationship to cardiovascular disease, cancer, and wound care. He is a scientist from MIT. Remember when we had Ralph Moss on from Sloan Kettering? I got a lot of flack saying, well, he's not a doctor. Well, Ralph Moss knows more about cancer than most physicians. And I always go back to a little factoid that amateurs built the Ark, professionals built the Titanic. So Professor Peskin is not a doctor, but he's a scientist, and he critically thinks about the issues. He reads journals. He thinks about them. Do they make sense? Are they scientifically valid? Do the statistics matter? And I'm not going to take up his time because I've asked him to come on and give us a lecture on parent essential oils because his work is not being recognized. And just last night I had dinner with a CFO of a major company. I said, you have to listen to this. He said, well, I talked it over with my doctor. He believes fish oils are still good. Ladies and gentlemen, this is not a religion. It's science. Okay? Believing in God, believing in the Creator, that's one thing. But this is science. And a lot of the studies done so far have actually flopped. Okay? They have gone no place. They have not proven anything. 3 large-scale trials were published in the New England Journal of Medicine. Proved nothing. Absolutely nothing. The conclusions of these meta-analyses was that fish oil consumption, either as oil supplements or by eating more fish, had no effect on all-cause mortality, cardiovascular mortality, cardiovascular events, coronary heart disease mortality, stroke, or arrhythmia. That's by reviewing other person's studies. You know, just like we bought into the low-fat diet in the early 60s, we bought into the Eskimo thing. Eskimos don't get heart attacks or whatever because they need a lot of fat. But they never considered the genome of the Eskimos. There were a lot of other things involved. So before we bring on Professor Peskin, I just want to summarize what I feel about fish oils. Their benefits have been overstated. Of course, the studies show the fish oil benefits may be short-term, but that's about it. Fish oil is highly unstable and vulnerable to oxidative damage. There is no evidence that healthy people benefit from fish oil supplementation. Taking several grams of fish oil per day may be hazardous to your health. And as Professor Peskin has told me, fish oils are antifreeze for cold water fish. And with that, I want to bring you on, Professor, and introduce, as I've introduced you. And you don't need an introduction. I want you to tell our listeners about your webpage and that great talk you gave in Boston.
Yeah, I appreciate it. You're absolutely right. Fish oil is the antifreeze for a fish. And to mention the coronavirus, I just sent you a comparison of different viruses. The what's that, HN1 or something that came out a few years back much more virulent than this. So you can look at that and talk about that to everyone next week. But yeah, if people want to check out what I write, they can just pull up my name. It's Brian Peskin. B as in boy, RIAN, P as in parent, ESKIN.com. There's a ton of information there. But exactly, fish oil in every experiment they do fails. The Cochrane Institute just did a scathing analysis. They're the best reviewer of studies in the world, said it's completely worthless for heart disease. I know some of your listeners may be going, but Lavazza just came out, got a study passed with 4 grams of fish oil, blah, blah, blah. And when that came out, I told all my colleagues, take a look at the placebo. The placebo will be a poison. It will simply be a little less of a poison than the fish oil, so relatively speaking, there'll be a positive effect. Lo and behold, after a day of trying to find it, mineral oil. Mineral oil is a derivative of hydrocarbons from gasoline production. It is horrible. It doesn't interact in the bloodstream, but it goes into the cell. So long term, anybody taking mineral oil, you're on the road to a nice death. So this is the state of affairs where we are. They got a placebo.
Professor, let me just,
yeah.
Okay, I wanted you to make that point about a placebo, which should be an inert substance, but the
inert everywhere, inert in the tissue, inert in the bloodstream. But the FDA made a very bad mistake and just said, okay, it doesn't interact in the bloodstream. No one asked, well, what's it doing in tissue?
Right. And when they compare other studies, though, it's not just
they should have made them use olive oil, and they didn't.
Yeah, but it's not just not fish oil. Sometimes, like Tamiflu, they compared to a substance that had magnesium citrate, and I mean, could make you vomit and have diarrhea. But theirs was a little less, so Tamiflu got approved. So I think that's a valid point you're making, that the placebo is not inert.
Yeah, it's not a true placebo. So there's so much money in pharma, they will stop at nothing to get a drug approved. And look how many drugs are approved by the FDA and then ripped off the market. Now, the FDA tries, but they don't do the studies. So if the pharmaceutical company is misleading them or withholding data, which they do all the time, they're the most fined entity in the world, is the pharmaceutical companies. Billions and billions. Look at the last one, the opioid crisis. Oh, it's no problem at all. And it's a major problem. So they will tell you anything. Tragic state of affairs we're in. So science, not opinion, is my motto. Fish oil, if you try and find out what is the metabolic pathway that this can possibly do anything, all they say is it gets rid of the omega-6. It displaces it. So if you take a massive amount of fish oil, all of your omega-6 goes away. Well, that's okay if you're eating adulterated omega-6, and most of it is. So all of these studies with omega-6 is bad, they miss one adjective, adulterated. And why is it all adulterated? Unless you're going to the health store and getting organic omega-6 oils, is to get long shelf life. So if you didn't have food processing and frozen food and food that has to stay on the shelf for weeks, I wouldn't be talking to you. We are doing it to ourselves. We're our own worst enemy, and nobody is using critical thinking anymore, especially the medical profession. They act like a study is a surrogate for physiology and biochemistry. To me, the study should confirm the established medical science, mainly physiology. Witchcraft and voodoo and magic is simply not allowed. Your opinion I could care less about. You want to talk opinions, this is your life here, people. Where's that doctor going to be, or nutritionist going to be, or health professional going to be 10 years down the road? after they tell you fish oil is dandy and now you got massive skin cancer because there's no fish oil in the skin unless you take large dosages of it. Then it goes in the skin gets hot, and like Dr. Ron said, you put the fish oil in the heat, it goes rancid immediately. This is why melanoma is through the roof with no end in sight. So they can't answer anything, but the science can answer everything. So that's what I try and give people. So I hope people will read a book, PE. Yeah.
Okay. And Professor Peskin, let's just get a little basic for a minute.
Sure.
And just explain about what omega-3 is and omega-6.
Yeah, there's two oils body can't make. Parent omega-6, parent omega-3. That's all you need to know. Body can't make it. Don't get it from food. We're dead. Now, what's the big deal? 25 to 33% of every cell membrane in every one of your 100 trillion cells is parent omega-6 and parent omega-3. And when you do the algebra in the body, the ratio of parent omega-6 to 3 is 11 to 1. So anybody saying we're getting too much omega-6 needs to go back to medical library and do some looking instead of just using their mouth when they don't know what they're talking about. We need 11 to 1 in favor of omega-6. Now, the problem is, just like I said, the adulteration. The omega-6 pathway is 20 times more powerful than the omega-3 pathway. The omega-3s do very, very little, and there's not a lot in the cell membrane. Regarding fish oil, DHA, EPA, less than a tenth of the parent omega-3 gets converted to DHA and EPA.
Wow.
There is 1,000 times more parent omega-3 in the body than there is DHA, EPA. And when you look at the recommendations by the medical and health profession of how much fish oil to take, they're telling poor patients to take 4 and 5 grams a day, which is a 20 to 500 fold times physiologic overdose.
Wow.
Put that in perspective, you take 2 aspirin to get rid of a headache. Try taking 200 and tell me how you feel. Don't do it. I'm being facetious. You will die. They are telling patients to do this on a daily basis. The brain uses 7.2 milligrams per day. That's it. That would be where I started before I opened my mouth and told someone how much they need to take. How much does the body use? National Institutes of Health and the U.S. Department of Agriculture both did superb experiments with radioisotope testing. I had to read these journal articles 3 times because I couldn't believe how little is used after seeing what the recommendations were, and nobody's listening. So the truth is right there if anybody cared to read it, and I'm one of the very few that do, but the people that don't see my work never get it. And I get emails from around the world on a daily basis about how horrible fish oil has been, but they kept taking it because the doctor recommended it, and the minute they stopped it and took the parent oils, the difference was phenomenal.
And ladies and gentlemen, just think about what Professor said. You know, we are using high pharmaceutical doses. It's like using 10 times if you're prescribed an antibiotic 4 times a day, 1 tablet 4 times a day, and you're taking 44 times a day. It
Exactly.
just doesn't make any sense. You're poisoning yourself. That's why I love this professor, and I learned so much from him because a year ago I didn't know this myself. I have to be honest with you.
Everybody's been brainwashed. It's not your fault.
But now I know better, so that's why Professor's here to educate us and about these parent essential oils. We don't want to poison ourselves. We want to live long. We want to keep our cell membranes pliable and let them do their work. Dr. Warburg also influenced Professor Peskin. I always follow Professor Warburg. I should have known this, but I didn't until Professor Peskin brought it to my attention. So I'm sorry to interrupt, but this is so critical for our listeners to understand that they're being poisoned by these fish oil marine lipid capsules.
Yes. And it's not just a 0, it's a -20. You literally are killing yourself. I wouldn't care if it just didn't work and say, okay, so they're making money on you. Free economy, do what you want.
So,
but this is actually killing you, and the average patient is trying like heck to help themselves, but they're getting misled.
Absolutely. And that's why you're here today, and that's why I appreciate you taking the time out.
My pleasure.
Are we... This is great, and I invite our listeners to tell their friends about this program. As I said, it can be heard on Alexa, Apple Podcasts. I don't know. There's so many. Spotify, Blueberry. We're on all of them, ladies and gentlemen. You can hear this podcast at any time. So, and also we have a YouTube channel that this will be posted to tomorrow, Dr. Ron. So, this information, you won't hear it at many other places. I mean, you can go to Dr. Peskin. He's on YouTube also, or Professor Peskin. But, it'll be in one spot. It'll be on Blog Talk Radio and all the other platforms and on YouTube. So let's get back. So we have we're being overdosed and poisoned with the fish oils that are recommended by physicians and so-called nutritionists. And so
now here's what happens. These fish oils displace the parent omega-6 and parent omega-3. One example, the biggest one, is the skin. The skin is 100% parent omega-6. So when you take a massive dose of fish oil, your body just can't get rid of it. It puts it in all the tissues improperly. And what people need to know is, first, fish oil spontaneously goes rancid at room temperature. Room temperature. It smells. That's why you go into a supermarket and the fish area smells horrible. That's the fish going bad on ice. What happens when it hits 98.6? Extra rancid. It is unbelievable. And Dr. Owen sent me a phenomenal article. The warmer the temperature of the water the fish lives in, the less DHA EPA the fish has. Up to 14 times less. So a cold water fish living at 40 degrees compared with a warm water fish living at 70 degrees will have 14 times less DHA EPA than the cold water fish. What are we doing? We're going the opposite. We live at 98.6, and we're taking more and more. We're doing the exact opposite in nature, killing ourselves. PGE1 is the body's #1 anti-inflammatory. Arthritis conditions are through the roof. Autoimmune diseases are through the roof, and these are all caused by a lack of fully functional parent omega-6 because it's all processed. So it's easy to fix most of these health conditions. We're our own worst enemy. It's like I have a Ferrari, which is the human body, and I'm giving it diesel fuel. Whose fault is that? We're giving a superb instrument, your body, the wrong fuel. You give it the right fuel. Takes 18 weeks, by the way, to get rid of the fish oil problem in the tissues. There's been studies on that. It takes about a year to get rid of most of the damage. But if you look at brown age spots, that's called lipofuscin. That is oxidized lipids in the skin. Those will also be inside the tissue. So if you have age spots on the outside, your organs on the inside are diseased with the same garbage too. Just think about that. They're everywhere. Major article just came out a year ago. the cardiac enzymes with fish oil in humans are down by half in the mitochondria, which means the energy for the heart is cut in half when you take this massive fish oil. Well, that's congestive heart failure. The heart just doesn't want to work. We have a massive epidemic of that. And cardiovascular disease is the number one killer. So if all this fish oil did anything, why are the cardiologist offices all overflowing? And they are all overflowing. You have to start using critical thinking. My joke, Doc, is everybody today is an idiot, but it's not their fault because they're EFA deficient. They can't think. There is no critical thinking. Physicians aren't taught this in school. All they do is look at a study and never, ever, ever forget studies are subject to manipulation.
Absolutely.
With statistics, and doctors don't know statistics in the least. I do.
No, you do, and you were the one to bring up absolute risk versus relative risk.
Yeah.
And the numbers, and nobody talks about it. Nobody talks about it.
Well, because if they did, it becomes obvious instantly. The stuff doesn't work. A statin, for example, the most highly profitable drug category ever, $14 billion a year, has a 99% failure rate, 1% rate. Put that in perspective. I give you 100 iPhones, 99 blow up in your face, and 1 works.
There you go.
Good job. That's the pharmaceutical companies. 90, and then doctors defend this. And I'm not talking about side effects of killing you either. I'm just saying it doesn't work.
Yeah.
And doctors defend it. The reason is because they have nothing else that they know of. Well, today there is. So I really hope people will hit my website and read the books, read the articles, and really learn some science.
Yeah, there are
because
books.
Without science, you're gone. And if you don't want to spend a few hours, God help you, you're going to have a bad death. You don't just kick off. You go slow. There's no reason to get cancer. There's no reason to get heart disease. Cancer, by the way, poor Rush Limbaugh you just mentioned, doesn't know any of this, doesn't know Warburg's work, because if you have full oxygenation in the tissue, not just the bloodstream, you can't get cancer. It's impossible.
I'm going to just go on a little tangent since we mentioned that, and I was going to ask you about this in an email. But what's your feeling? I know you talked to Dr. Rowan. He wrote a great review for you also about ozone.
We did the book together, PEO Solution. My co-author is Dr. Rowan, so we've done a book together.
So he believes in ozone. Do you agree with his philosophy?
Oh yeah, ozone's great, but you need to have it injected into the bloodstream. The oils you can just take in the body. So the oils are ozone on a daily basis, 24 hours a day. You can't beat it.
Oh my gosh! You know that's a great analogy. I never thought of that.
That's it.
Wow. All right, so Professor Peskin is our guest today. He is the expert on parent essential oils. So let's just talk. Let's just summarize right now. Fish oils are deadly. They are poisonous. And not only poisonous, like the professor says, they're negatively poisonous, which means you're going to have an earlier death. So you want to get rid of those right away. And what do you replace them with, Professor?
They're plant-based seed oils. So like these oils come from sunflower seeds, safflower seeds, evening primrose seeds, flax seeds, pumpkin seeds. There's plenty of places to get them. The key is you need to know the right ratios and some of the specific oils that you want. And it's not a field for amateurs, and there's very few in it. And it's once you get it, and it works for everybody within 30 days. So you will see the effects, in particular the energy. You are just the Energizer Bunny all day long. Anybody that's over 60, don't think, oh, you get older, you're just supposed to die.
Yeah.
And have no energy and, be in a nursing home like a zombie. No, not at all. So we just keep getting misled.
So these are dosed according to weight
yes, because it actually makes the tissue. Every one of those 100 trillion cells, and you don't need a lot. For example, one little teaspoon of oils is good for a person weighing 160 pounds. If they have nothing wrong with them. Now, of course, you can take more if you have a condition you're trying to help, but a little goes a long way.
So it helps a lot of chronic illnesses, diabetes, heart disease, arthritis, cancer. What are are there any downsides?
No.
Can you overdose? Yes,
you'll get too much of the omega-3. And you can tell this by excessive bleeding. It's called a hematoma. You smack into a wall, black and blue mark. If you start getting those, you're getting too much of the omega-3 in you. Bleeding gums, but it takes a lot. You need to be taking triple the dosage, and nobody needs to be doing that. I like a lot of bang for the buck. I don't like people wasting money when they don't need to. So I start out conservatively and tell people increase the dosage until you see a positive effect. And if you don't think it's working, stop. That's the first thing. I talk to people all the time. I take extra vitamin C. Is it working? Never did for me, but stop taking it. Do you feel or see any difference? No. So we answered your own question. This is it with 90% of the supplements. I don't see or feel a difference, but everybody tells me to take it. My joke is, if everybody says to do it, take it to the bank, it's wrong. Because they don't know what the hell they're talking about.
All right. So if a person's on they have a stent and they're advised to take a antiplatelet drug, they should be a little bit careful with this?
Nope, don't need to be careful in the least. Helps it.
Okay.
There's no contraindications. It's a natural blood thinner, so you'll be able to take less of the quote blood thinning drugs they all have everybody on. This is natural. Blood pressure goes down. It makes the artery more flexible, like a balloon. Reason your blood pressure is high is because you have an artery like a straw. It's not flexible, and then it cracks, and then you got problems.
The intima. Yeah, the intima.
It's called the intima. By the way, great point. The intima is 100% parent omega-6. So I always joke with the fish oil people, show me the metabolic pathway. Taking fish oil would possibly help heart disease. I've never heard one yet because there isn't any.
Wow.
There isn't any.
So how does that cholesterol, in your opinion, get there?
Pardon me?
How does the cholesterol get into that artery?
Well, the first thing is you need to understand what cholesterol is. It's the most ubiquitous substance in the body. Cholesterol is everywhere.
Exactly.
If you don't eat cholesterol, your body makes it. First thing you got to understand about cholesterol is, and I just wrote a paper for this for a couple people. A couple physicians wanted a summary of cholesterol. There's no cholesterol sensor in the bloodstream. Okay, big deal. It's a damn big deal. Here's why. There's sensors for everything. Biggest one is sugar, blood glucose. Everybody's glucose sensor is within 0.1% of each other, which means 1 part in 1,000. So that's the 70 to 90 milligrams per deciliter. If the diabetics are pricking their finger or using a meter, that's what that number is. And by the way, you can convert that. 70 and 90, you can put it to teaspoons, tenths of a teaspoon, which means in your gallon of blood, you have a sugar level of less than a teaspoon. The average American has been told by our government, by our doctor, on a high-carb diet to consume 70 to 100 teaspoons of sugar a day in a system that keeps 1 in it. Okay, big deal. That is a big deal. Here's why.
It is a big deal.
Where's all that excess sugar go? You have to look at insulin. Insulin is defined, textbook of medical physiology, fat storage hormone. So you're a good doctor. You're a good health nutritionist in the 80s and 90s, and any jackass telling you you want a high-carb diet is putting you on the path to obesity and diabetes. Does that pan out? My golly, diabetes is the number one epidemic in America and the world, and it's created disease because pre-1940 there wasn't any. It was an academic exercise. There were no type 2 diabetics. So I was one of the first to say diabetes, for the most part, is a created disease unknowingly. You did it to yourself. So if people don't read the information I write, and I don't have time to talk to a lot of people, so I write extensively, you're in deep trouble. You listen to people that don't know what they're talking about, you're in deep trouble.
So, ladies and gentlemen, we're talking to Professor Peskin, and he is just bringing home the point that I've been making for the last 5 years. You have to be the CEO of your own body. You have to take control, right? You have to take control. You have to be educated. And that's why I appreciate him taking the time out to educate us. I learn every time I speak with the professor. So Brian Peskin is Peskin. Just Google him. You'll get to his website. He has lots of articles and his bibliography. And he's underappreciated, in my opinion. I want to have him on more frequently. He should be. You should be quoted all the time. But nobody thinks anymore. And I before I retired, I was teaching some residents, and they were Googling diagnosis. They all the tests were normal, so they say, well, let's go back and think about it. I mean, they're doing it backwards.
Yep. They're doing it backwards. And there's more and more physicians that are becoming integrative medicine physicians, which simply means I'll use a drug. And antibiotic drugs short-term are great. Steroids short-term are great. And by the way, fish oil acts like a long-term steroid. So ask your physician what he thinks of being on a steroid for 5 or 10 years. He'll look at you in horror. That's what fish oil does. It stops
that's a great
all
point.
the EFA metabolism. Oh, you're on the road to death. I am not joking about this.
Tell our listeners more about that. About
it acts as a long-term steroid. I've lectured on this and told doctors this. They gasp because they don't want to be hurting their patients. They have no idea. But you talk to somebody. Well, this is why you'll get dermatologists going with Brian. Fish oil works really well to help the skin for psoriasis, for dermatitis, and the dermatologist called me and said, Brian's acting like a long-term steroid. It's horrible. So you get rid of that, put the oils in. Now, if they don't work, you can take some of this steroid. But typically, for most patients, does the job. Your skin is phenomenal. Phenomenal. We're doing studies right now with people with very, very bad skin diseases, and diabetic foot ulcers, too, that are hellacious, and healing them. We're helping them to heal, so it works. It's not open to discussion. It's not open to opinion. It's physiology, and it works, period. Has to work. I laugh at people because I go, what, you doubt me? The science is right here. You just haven't read it. This is all I do, by the way. I spent 20 years at this, and I connect the dots very well. And don't think it all came sequentially. It didn't. It'd be, I got a piece here, I got a piece there, and 5 years later, now I connect the two the way I know they have to be. I knew they had to be connected, but I couldn't prove it. And so it took a long time, but now everything is proven. I've never been shown wrong in 25 years. I've had papers retracted on fish oil because it's become politicalized, just like you have with Trump. They don't care about the truth.
Right.
But I've never been shown wrong in what I present or in the science ever.
So Professor,
Yeah.
these parent essential oils are made from plant seeds,
Yeah.
can you recommend, or can I recommend the recommendation you gave to me, where our listeners can look get this? Can they get
Yeah,
it?
I don't,
GNC,
I don't give specific brands. What I can do though is give what you need. You need more of the parent omega-6 and the parent omega-3. Has to be organic, because if it's not organic, you're getting chemicals and you're getting the problems that we want to avoid.
Exactly.
Has to have a hard gel capsule so the oxygen transfer is minimized, because oils can go bad with heat, with time, with light. So you want a hard gel cap. Most people don't do that. They use soft because what they put in there, it's going to be a problem anyway, so they don't care. You have to have low penicillin levels, which most people don't even check. It needs to be under 19. If you run the formulations I like, they're about 6. To put it in perspective, 19 above it is hazardous. The best fish oil in the world is at 19. So you have...
So 19, that's a milligram per deciliter. What is that?
Nah, it's a different measurement, but it's called a secondary aldehyde, and these are horrible. They ruin the DNA. They go rancid. They ruin everything in the body. And one of the sources is fish oil.
Okay.
But not from the plant-based oils. Your body is very resistant to oxidation of the parent omega-6 and parent omega-3. It doesn't happen in the body.
So, you just bring up points that are just so natural. I mean, our bodies are the best pharmaceutical companies. They can make anything we need.
You're darn right.
We have to give them the right substances to make it. We have to provide.
It's like antioxidants. Here's another one. Everybody's trying to get antioxidants. There's all kinds of commercials for, palm, all these things on there. Your body doesn't need any oxidants coming in from outside. It makes them. It's called SOD, superoxide dismutase, glutathione. Your body makes them just fine with the raw material. Just like with the parent omega-6 and parent omega-3, makes all the long-chain metabolites, GLA, EPA, DHA, as needed. Does not need your help. The one thing I do advise in a formulation is GLA, back to your original question, because there's something called the delta-6 desaturase enzyme. And if you have a disease, that will be impacted, and the amount of PGE1, which I told you is the body's number one anti-inflammatory, will be decreased. So to eliminate that potential problem, if you give the body some GLA, it bypasses that step. So we're using a trick, but only because it's needed in a certain population, and it's a great trick. And you put parent omega-6, parent omega-3, some GLA, you're done. Your body has the total fuel in the lipids area.
Yeah.
And this oil, this formulation, is the perfect adjunct to any treatment any physician is giving to their patient. It will turbocharge the effectiveness of any treatment because it's so fundamental. That's what people really need to know. Just add this to it.
Listener number one, ending in 5686. Did you have a question for Professor Peskin?
No, not at this time. I'm overwhelmed by the speech.
Okay, well, you can listen to this again, and
it is overwhelming. It's like trying to take a drink from a fire hose, and it's the opposite of what you've been told. So even the physicians read my books 3 times because they can't believe what they're reading. So don't feel bad. But there's a lot of papers on my website. You can read it. There is, you mentioned, videotape lecture I just gave in Boston at the International Lyme Disease Conference. So we recorded it just for people like you that want to get the guts of this and to be able to repeat it. And it's December 2019. So it is as current as you will ever get and as state-of-the-art as you'll ever get. And I specialize in giving physicians the medical science they haven't seen before, because there's no reason to regurgitate what you know. I'm giving you stuff you haven't seen. Why? Because you're not reading the medical journals I am. You're reading New England Journal of Medicine, Journal of the American Medical Association. These are clinician journals for patients. I'm reading lipids, essential fatty acids, prostaglandins, leukotrienes. I'm reading these highly technical Journal of Biological Chemistry. I'm reading journals for lipid information that a doctor never even looks at. And unfortunately, the journal information doesn't make it mainstream. One of the biggest things that just came out is fat is not immobile, or it moves and is very big in wound healing. It tries to heal a wound. So fat stores go to the area of a wound to try and help it. Well, up until now, everybody thought, oh, you got fast, it doesn't do anything. Just sits there. Dead wrong. So most of what the medical profession knows, and I say knows, is wrong. It's a horrible state of affairs. And they don't want to learn. That's the worst part. They don't care.
No, they keep using this word, I believe it works. I mean, it drives me crazy when they say that. I believe
Why
it.
should you care what you believe?
Yeah, exactly. Not
I have no interest. When anybody says that, I say, that's nice. I don't give a damn.
Exactly.
You know, voodoo and witchcraft it doesn't count with me. I want to know the metabolic pathway. You're talking my life here, not politics, not art, not a painting on the wall. Do I like it? Do I not like it? I'm going to live or die by what the hell you tell me. And you're going to be gone when you kill me. You'll be unaccountable, and the only reason I last so long without dying right away is because the body is so good.
Yeah.
That's why these drugs get approved that don't kill you right off the bat. My joke about this is any drug will be approved as long as it doesn't kill you right away. Because if it kills you during the trial, they have to stop it. If you last 3 months, it's over. You got a drug.
And our listeners know, because I've referred them to PubMed, how many drugs are recalled after a year or two.
Well, we have the opioid crisis.
Yeah, and recently,
killing people.
Like you said, the FDA almost will approve anything, and 2 drug companies pull back the release
unless people die.
Right?
Unless people die, there has to be a very small benefit, and unless they die during the study, you get the drug, and the doctor doesn't know. I don't blame the doctor. It's not the doctor's fault. They don't know.
Well,
but people think they know. That's the problem. People put that's the problem. They don't understand. He's going by what the drug rep told him. He doesn't know.
Oh, gosh. Well, ladies and gentlemen, you've been listening to Professor Peskin. He is the expert on parent essential
Probably
oils.
Enough for one day, huh?
Yeah,
I hope they hit my
so.
website, take a look, and they can
have
questions
we'll
from
have
that.
You back for just a question and answer session with our listeners. I think
Very
that would
good.
really be good. But I want to just leave you with one thought that's going through my mind. It's appearing to me at my age and my 55 years of medical experience that everything happens at the cell membrane.
Yeah.
And if we have 6 cell membranes, we're not going to live a long and fruitful. We're not going to die young as we get older. We're going to die old.
Right.
So it looks like anything we can do, oxygen, systemic enzymes, and parent essential oils, to keep that cell membrane functioning is what's going to help us to lead a more productive life as we age. Do you agree or disagree with any of that?
You've got it.
Okay.
The cell membrane is everything. That is the actual brain of the cell. It's not the nucleus. You can rip out the nucleus, the cell will live for months. You rip out the cell membrane, dead in a couple weeks. So even that part is wrong. For centuries, the cell nucleus is everything. No, it isn't. Dead wrong. But Warburg got it right. The first page of his book and the first page of my book in tribute to him, the cell membrane is everything. And it's not what's coming in and out of the cell membrane. It's the membrane.
It's the membrane. So
Hidden Story of Cancer, page 1.
All right. Now I'm just going to give you one more thing. I mean, I have listeners call in. I take 32 supplements. I take 16 supplements. I've been doing it for years, and I'm not going to stop. Well, obviously, you can't argue with them, so they're not, because they already made up their mind.
Yeah, it's a little much. You know, the first thing is, how much stuff do you really think you need to be taking? If it's the right stuff that's fundamental, that's all you need.
Yeah, if it's a
your
building
body
block,
can do the rest, right?
Okay, that's it.
Right.
I mean, you've answered that. So, ladies and gentlemen, Professor Peskin, please go to his website. Okay.
BrianPeskin.com. It's all there.
And look at, I'm going to recommend that you look at that video from Boston. That's
it's right there too, page 1, right on the right side.
That's what prompted me to call him to say, you have to tell our listeners about this, because it is succinct. If you listen to that, you wouldn't have had to listen to this program today. But I'm glad you tuned in, because I want you to spread the word about Dr. Ron, Unfiltered, Uncensored, and our fish oil capsules poisoning you with Professor Peskin. Okay, really important. And he did us a great service today by taking time out from his busy schedule and his family to be here with us. So I really do appreciate it, Professor. And
My pleasure.
We're going to have an hour and a half show just inviting questions from the audience, and I think that'll be a blast.
Look forward to it.
So thank you so much. God bless, and have a great weekend.
Bye-bye.
Bye. So, ladies and gentlemen, that was Professor Peskin. He is definitely the expert. I hope you learned something today. I know it was a lot. We tried to keep it down to 40-some minutes. But there's just too much information to learn about these parent essential oils, PEOs. If you are in doubt as to what company to buy them from, or you can drop me an email at docronradio@gmail.com, docronradio@gmail.com. I'll give you a company that I think is really good and follows Peskin's protocol and guidelines. So, ladies and gentlemen, this was this week's program. I feel good about having the professor on. Next week, I'm going to devote most of the program to the coronavirus and what it really means. Is it a hoax? Is it not a hoax? Has it been overhyped? Is it been a disease that was created to control people? We'll get into it. I have a lot of information on this. I have some coming directly from China. Because that person has been in this province. They've had a business in there. And it is, to start with, they were having lots of pneumonia from the pollution. Anyway, last year there was a large demonstration against the pollution in that city. Pneumonia was the number one cause of death, even before the quote-unquote coronavirus. And if you get the coronavirus, it looks like maybe 1 out of 1,000 might die. And it is not affecting children, thank goodness. So, we'll talk about that next week. I want to thank you for listening in today. Professor, is always a pleasure to have him. And we're going to end up the program today, and we will see you next week on the radio. Have a great week, and thanks for tuning in. Ladies and gentlemen, thank you for listening to Dr. Ron, Unfiltered, Uncensored, with your host, Dr. Ron. We are here each and every week. Thank you for taking the time out of your busy schedule. We bring you medical news that you can use. Medical news that's up to date on drug reactions and interpretation of medical articles. We also have some great guests scheduled. So thank you again. Have a great week. Listen to us on Apple, Alexa, iHeartRadio, TuneIn Radio, Spotify, Stitcher. Ciao.